Hey, Sugar Lumps, how you doing? Happy Friday. Listen, I hear that there is a 2024 measles outbreak right now. And so I was actually thinking yesterday, I wonder if people actually know what vaccinations are intended for. Like, do you know the diseases that they're intended to protect your child from? Because I know that there are a lot of people that take their children to the doctor. The doctor says, okay, you have to get these vaccinations for your child to protect them, and you got to get them for them to go to school. So a lot of parents just be like, okay, just give them to them because we got to go to school and we just going to keep it moving. You know, now for the people that don't believe in immunizations, for the people that um, don't believe that others should take them or their shots. This ain't for you. This not message for you. This message is for the people who um, are getting the vaccinations, but just really don't know what they are to protect their babies from. So I want to tell you. I just want to give you that little piece of knowledge that, vaccinations were created for a reason. Um, how they were created and all of that. And that's not what I'm here to discuss. I just want you to know that if your child received the vaccine, this is what it's for. Okay. All right. Get your pen and paper. Here we go. So, let's start off with chickenpox or the varicella vaccine. Now, I know you've heard me speak of the varicella vaccine because varicella is a strain of herpes. And so, once your child gets the chickenpox or the varicella vaccine, either or, okay, um, they do have this virus in their body. So, that is a strain of herpes, and they'll have that. Now, before the vaccine, it said that 11,000 people were hospitalized and 150 people died from chickenpox every year. That was before the vaccination. It's super contagious. The po babies be miserable. It can lead to complications with infected blisters, pneumonia, bleeding disorders, swelling of the brain, and even death. Okay. Once a person is infected with it, it remains in the body for life and it may reappear shingles once they get older. And, it's interesting to me that that is all it says. See, at this point, I really believe that it should be said that, yes, it's a virus, but it is a strain of the herpes virus just to try to reduce the stigma around herpes, because that's my goal. Okay. But this ain't that. So let me go ahead and finish telling you. Everybody knows what COVID is. Everybody in 2024 knows what COVID is and knows what that's about. Okay. So I won't even talk about that. All right. We're going to talk about diphtheria. All right. Now, without treatment, up to half of infected people die from diphtheria. Okay. The highest death rate for diphtheria is for children under 5. Can you imagine? Under 5. All right. It's a bacterial disease. It causes heart and nerve problems. The disease can be spread from an infected person or somebody that's carrying the bacteria by coughing and sneezing. And note that a lot of these diseases are spread by coughing and sneezing. Now, kids is nasty. Kids is nasty. They will cough, sneeze right in your face, and keep talking. Like it's nothing. Okay. You got to teach them better. But naturally, they just, and then they do one of these, right? And then they go play with the toys. So it's important to protect your babies, um, because that's what children do. They play, they don't pay no attention. And again, these are diseases that you protect them from when they're young. These are the things that you're protecting them from when you give them the vaccination. So once they're infected, they create toxins that come from the bacteria and can spread to the bloodstream and other organs, can damage the heart, kidneys, and other organs. Nerve damage and paralysis can result. So let's talk about the next one, which is Hib, or Haemophilus influenza type B. Without the vaccine, Hib disease can kill about 1,000 children in the U.S. each year. 1,000. It's a bacterial illness, especially for children under 5. The most common type is meningitis, right? That is the infection that's covering the brain and the spinal cord. But then you have pneumonia, you have bloodstream infection, and you have an infection that's in the throat. Even with good medical care, as many as 1 in 20 kids who get sick with meningitis will die from it. And up to 1 in 5 who survive will become deaf or have brain damage as a result of the infection. It is spread when a person coughs or sneezes. Okay. The bacteria stays in the person's nose and throat, but they do not cause areas. They actually don't know why it leaves the nose and the throat and spreads and causes illness. They don't know, but they like, okay, you get this and we can for sure stop it. All right. So we got hepatitis A. People can get hepatitis A by touching objects such as doorknobs or diapers or eating food that's been contaminated with the virus. This is the one that you may get if you go to a restaurant and somebody back there nasty and ain't wiping their hands and be touching on your food and stuff. So let's talk about hepatitis A. It's a disease of the liver, and hepatitis B affects the liver and C affects the liver as well. It's a virus. It can be mild. It can last a few weeks, up to several months. Now, it's spread by, of course, touching the foods, drinking after one another. Now, remember, we're talking about children, okay? Because when they wipe, how well do they wipe? How well do they wipe? Do they have it on their hands? How often? We don't know. Them babies is gone. They just playing. So normally those things are contaminated by the poop of an infected person, or somebody not washing their nasty hands. All right, so we're gonna move on to hepatitis B, and actually each year up to 1 million people die from hepatitis B. Ain't that crazy? So, hepatitis B, again, is a serious liver infection. Some of them can lead to liver failure, liver cancer, cirrhosis. Cirrhosis is another condition that you can get from drinking a lot, but this ain't that. I was just throwing that in there for just a bonus information. Roughly 1 in 3 people worldwide have been infected with hepatitis B. It spreads through the blood and infected bodily fluids. It can be passed through blood, unprotected sex, illegal drug use, unsterilized or contaminated needles, or a woman can give it to the baby if she's pregnant with it. So, we want to protect the children from getting it, because we know that when they in preschool and when they share everything because that's their friend. They share everything because that's their friend. So, over the last, so many years, I don't know, 20 years at least or so, they developed HPV because HPV is the number one STI that is contracted, that causes cancer. It also causes different types of warts. Now, there's a few different strains of HPV. Some of them do not cause any issues and can resolve on their own, but others can cause cancer and be a whole problem. So I'm almost done here. Look for part 2. Thank you. Bye.